In a study inspecting racial bias in an algorithm, researchers found that an algorithm meant for identifying and helping patients with health needs had significant racial bias. The algorithm gave more white patients access to healthcare management programs, even though they were less sick than black patients. The main reason for this bias comes from the fact that the algorithm used cost as a figure to determine a patient's risk. The problem with this is that blacks at a certain level of health generate lower costs than whites, despite being just as sick. Higher costs do not correlate with higher sickness. I found this problem interesting because the point of an algorithm is to eliminate bias and increase accuracy, but instead it continues to emulate bias when a factor in the algorithm is not correct. I think that with time, researchers will eventually be able to refine their algorithms to help provide useful healthcare solutions in the long run.
As technology has advanced, our abilities to create complicated algorithms to support them has also grown. Modern technology makes many tasks automated, seemingly with less or no need of a person's aid. There are many tasks, though, still proving difficult to automate, such as self-driving cars and healthcare. Studies have found that some systems' algorithms had racial bias. When creating algorithms for systems as complicated as healthcare, it is important to use a multitude of factors and variables. Just like how self-driving cars must take into consideration lights, pedestrians, cars, and other unexpected events, healthcare algorithms have to take into consideration costs for care and treatment, preventative measures, economic status, degree of sickness, length of each solution, patient history, and many others as well.
Jana Rogi wrote a book about the racial algorithm discrimination called Race After Technology. She said the algorithm make a racial bias. For example, if a person living in low-income communities, then his or her health insurance price was higher than the other people. The fact behind this problem is because the insurance company thought low-income people living with bad habits, like eating high sugar food, eating a lot of junk food. And those bad habits cause the body health condition to lose control. But not everyone living like that. Some of the people take care of their life, but unfortunately the algorithm classifies the people according to their neighborhoods. At Chinese side, the algorithm is not specific enough, but the Sanjana side, the main reason is the algorithm's creator is not diverse enough, so she suggests more people to create the algorithm.
Hi guys, so for this week's videos, I'll be talking about crowdsourcing. If you haven't heard about what crowdsourcing is, basically it's how data from a public space, like a public source like Google or Yahoo, can be taken and then used for business-related matters. For example, imagine being in a crowd of people and you're asked to gather a collection of information to complete a business-related task that is usually performed by a staff member or a contractor from the prospective company. This information is used to make an open call to a broad community of people, either through collaboration or competition. Another really good example of how crowdsourcing is used is taking something that we use every day, like Waze. And this is just a GPS navigation app. And when people are stuck in traffic, they can often report that they're in a traffic jam, or even being online and in traffic allows other users to know that there is traffic ahead or that there is an alert for traffic.
Hello, my name is Elizabeth, and I wanted to talk about some problems and solutions when it comes to crowdsourcing. So there are several issues that arise with the practice of crowdsourcing. One issue is the lack of confidentiality. Since there are many anonymous people working on the issue, people may not feel confident on disclosing personal information. Another issue is lack of communication. Because you're reaching out to a group of people you may not know very well, you may not be able to communicate in a meaningful way or help them really understand the problem. The third issue that can arise from crowdsourcing solutions from a large group is a lack of engagement and time commitment, where you may receive ideas more than a solution. However, these problems can be fixed with a multidisciplinary and motivated team, and crowdsourcing is only as effective as you anticipate it to be. So a team works better together if they bounce ideas off of each other rather than if they work as individuals.